We're at our final task, task number 10 of domain 4, and you must understand when it is appropriate to have an ABN signed. Well, if you viewed part 1 of our medical insurance and billing, then you know that an ABN is a form provided to Medicare beneficiaries when something may not be covered for the following reasons. So here are the 3 reasons. When something is not may not be medically necessary and it may not be covered, an ABN form must be completed. Also, when what the service or the treatment is not a covered benefit, an ABN form must be completed. And let's call it by its name. Advanced beneficiary notification must be completed. And finally, frequency limitations. Let's say that you're only permitted to provide one service or encounter, such as annual physical, only once a year. So if you try and obtain 2 visits a year, you're limited by the number of frequencies of that service, and you may not it may not be covered. And if that is the case and the physician knows it, they have to give the patient an advanced beneficiary notice. I'm going to write it out. And I know you all know this because you viewed the part 1 billing lecture. But just for the sake of being thorough, there you go. All right. So what does an ABN look like? It looks like this on the right. All right. So this doctor, if they know that something may be not medically necessary, if it's not a covered benefit, or if they've expired the number of, or they've exceeded the limitations of the service, then they have to give the patient this ABN notice. And they have to give it to the patient in advance of the service. And they have to give them the form CMS R131. That's your ABN form. And if that provider fails to provide an ABN for one of those 3 reasons that we've mentioned, the patient can file a claim with the Office of Civil Rights. I know that's not patient privacy, but this ABN violation, ORC, they that's their area. All right. So just so you know, this is primarily Part B, Medicare Part B services, and some Part A services. But Medicare Part B, things that are carried out in the outpatient or doctor's office, have to use the ABN. And even though this is not required, I just want to tell you, if it's inpatient, they use the HINN form. Okay? But this is outpatient. So let's go ahead and let's test your knowledge about the advanced beneficiary notice. All right. A Medicare patient, visited the doctor's office for a routine annual physical last month. She was surprised to receive a bill from the physician for $100. She contacted the billing office, who told her that the $100 deductible had been met after the encounter, and she would be responsible for the $100 fee. Should the physician's office have provided the patient with an ABN to let the patient know that, hey, you're going to owe $100? What say you? Yes or no? And why? And if you said no, outstanding. Remember, it's one of these three reasons: something that may not be paid because it's not medically necessary, something that's just flat out not covered, and the beneficiary should probably know that, and also frequency limitations if they've exhausted the number of services or treatments, etc. All right, but not all the time do um, patients know what's covered and what isn't. And that's why this ABN is so important. And just so you know, deductible is a part of the patient contract with the insurance company, and that must be paid. So often now, um, providers know or should know if a patient has met their deductible or not. They should, but that is not their area. And actually, most insurance contracts require that deductibles are met before they pay anything. So, no, it is not required for an ABN for a deductible or any out of pocket for that matter. I got one more question for you. Is an advance beneficiary notification required? A Medicare patient had his nails clipped by his podiatrist. The insurance company denied the treatment as not medically necessary. The podiatrist billed the patient for the fee. Was an ABN required? If you said yes, outstanding, because it is one of the reasons that doctors must provide an ABN. If it's not medically necessary or may not be covered, that doctor is mandated to give that ABN. And if the doctor fails to supply the patient with the ABN for their signature, then that patient can go to Office of Civil Rights, file a complaint. And if founded, that provider will not be able to bill the patient. All right. So this concludes Domain 4. And I want to direct you to Domain 4 assignments. Go ahead and follow them in the order presented. And then let's be ready for Domain 5.
Thanks for tuning in, and until next time, happy coding.